Contraindication of calcium disodiatate, that is anuria, hepatitis, and renal disease, hepatic disease, renal disease precaution. Blood encephalopathy, cerebral edema, patient may experience increase lethal in intracranial pressure following IV infusion. IM route is preferred for this patient for administration of a BALA is useful in case where the IV route is necessary. Avoid rapid infusion. The dosage should be followed and at no time should be recommended. Daily dose should be exceeded. D-penicillamine. Penicillamine cupramine depen is a metabolite of a penicillin. Having no antibiotic properties, silent features, L-isomer, penicillamine is a toxic. It inhibits the actions of a pyridoxine. May produce optic neuritis, thus never used. Indication penicillamine. That is used against copper, lead, mercury, chronic exogenous copper poisoning such as Indian childhood cirrhosis, Wilson disease, due to disorder copper metal, cystin, urea, rheumatoid arthritis, and scleroderma. Dose 30 mg per kilogram, body weight up to total 2 gram per day in 4 divided doses orally for 7 days. Complication: aplastic anemia, granulocytosis, cutaneous lesions, immune system dysfunction, renal and pulmonary disease used during pregnancy associated with the congenital abnormalities. About 25% of patients who are allergic to penicillin display hypersensitivity to D-penicillamine due to contamination with the penicillin rather than immunological cross-activity. In acetyl D-penicillamine, it is another penicillin metabolite useful in mercury. Dose 1 to 2 gram per day orally. It has used successfully in the Barca poisoning grain disorder. It is equally effective as a DPA, although less effective than DMBS, which is the most effective of the used chelating agent. Next is deferoxamine. Deferoxamine is a bacterial pseudophore produced by the Actinobacter Streptomyces psilocysis. Silent features: mesylate salt is the commercially available, useful in acute iron poisoning. Pseudophore, small affinity, high affinity and chelating compounds secreted by microorganisms such as bacteria and fungi. They are among the most soluble ferric Fe3 plus binding agents known. Microorganisms secrete them to sequester iron from surrounding their own use. Availability: deferoxamine mesylate is available in 2 vials size containing either 500 mg or 200 gram sterile lipofuscin powder, adding 5 ml or 20 ml of sterile water for injection to either the 500 mg or 200 vial. The spell result in 100 mg per ml. Dose oral 5 to 10 gram per day. IMI initially followed by 0.5 gram for 8 hours later, and then every 4 to 12 hours. Total up to 6 gram in 24 hours. IV given only for patients in shock, 1 gram per at a rate of 50 milligram per kilogram, followed by 0.5 doses every 4 hours. Total up to 6 gram in 24 hours. This is a recommendation for total doses are not scientific developed and based on arbitrary assumption. Effectiveness: 1 mole of DFO binds 1 mole of Fe3 plus, therefore 100 mg DFO binds up to 8.5 mg per kg. About chelators, that is iron pyridoxal isonicotin hydrase, pyridoxide benzoate hydrazone, dafepirone, nickel, thallium, Persian blue. Natural chelators: metallothione, discovered in 1957 by Vale and Marshall from purification of cadmium medium protein from horse renal cortex. The metallothionein is a family of cysteine rich of low molecular weight ranging from 500 to 1400 protein localized to the membrane of Golgi apparatus. Golgi apparatus have the capacity to bind both the physiological zinc, copper, selenium, cinnabar, cadmium, mercury, silver, heavy metals through the thiol group at the cysteine residue. MTA function is not clear, but experience as MT may protection in metal toxicity. Next is a serological antidote, that is immunotherapy, anti-snake venom, anti-spider venom, fab therapy of digitalis, and PCP, the immune therapy of arsenic. Physiological or pharmacological antidote, physiological works at the larger cell by producing pharmacological effect exactly opposite to that produced by poison, also known as dynamic antidote. Act on principle of antagonism. Action is mostly partial. The reuse is limited, somewhat dangerous. Used after poison has been absorbed in circulation. Example: analeptic against barbiturate. Restorative strengthening are arousal agents which include a proconvulsant, picrotoxin, strychnine, pentyl, and tetrazole camphor, sympathomimetic amphetamine, methylphenidate, xanthine, caffeine, ethimavin, non-specific stimulant, Prethcamide, amphetamine. They were all once recommended against barbiturate, but they are not more recommended. Amyl nitrate against cyanide, barbiturate against amphetamine, picrotoxin and cyclin, physostigmine against atropine, even some more antidotes and poisonous when they are used. Thank you.